a lot to unpack on the subject of transgender ideology and medical treatments for it. Dr. Monique Robles joins us now to offer her professional opinion. Thank you for speaking with us today. Dr. Robles, gender confusion or gender dysphoria is defined by the American Medical Association as a psychological condition. First, can you explain exactly what that means?
Of course. So gender dysphoria, as related to the distress associated with any individual who do not identify with their biological identity or their biological sex. So it happens to do with the distress, which is supposedly socially induced. And so the idea with society is to reduce that stigma. However, what's happening now is that the WPATH and the American Psychiatric Association and others are attempting to depathologize this distress or this association with gender dysphoria and basically normalize any individual who does not identify with their biological sex.
And then what are the best treatments for this? You say that there's a diagnosis that is trying to kind of being erased, but in the meantime, this is still a dysphoria and it's still something that's being treated.
Okay. So the recommended treatment right now is gender affirmative therapy, which has to do with social transition, puberty blockers, cross-sex hormones, and then sex reassignment surgery for those, or gender, what they now call gender confirmation surgery for those who desire. This is the widespread recommended treatment. However, the psychological component is being minimized, which is actually what needs to be emphasized. And so in my professional opinion, there is no medical indication for gender affirmative therapy. We should actually be looking at the root cause of why these individuals do not identify with their bodies and with the way they were created. And in doing so, we will be able to unpack a lot of mental health comorbidities that exist in these individuals.
What do you mean by mental health comorbidities?
Sure. So many of these individuals suffer from anxiety, depression. Often there's an association with autism and spectrum disorders, oppositional defiant disorders. So if these are not addressed and are present prior to the gender identity discrepancy that arises, then we are missing important details in an individual's history.
So you were mentioning the World Health Organization for Transgender Care. They've stated that most children grow out of this gender dysphoria. Does this guide the treatment in some way?
So the WPATH says that most children grow out. However, the recommended treatment does not allude to this because what's actually happening is that children who are started on this pathway tend to continue on this pathway, which is the opposite of the natural course or the natural progression of those who are diagnosed with gender dysphoria. Typically 80 to 85% of these children by adolescence will identify with their sex and without any intervention.
You were mentioning that this new standard of care, the affirming care, is something that's recent. How recent is it?
Sure. So in 2007, the first gender identity clinic was opened at Boston Children's, and it began after looking at the Dutch protocol in the late 1990s, early 2000s. And actually, the early Dutch protocol did not call for social affirmation. This is a more recent addition to gender affirmative therapy. It used to be the beginning with the puberty blockers and then moving on to the cross-sex hormones. However, now affirmation is the initial stage, and it's actually beginning outside of medicine and in classrooms.
So let's talk a little bit about adults and not just children. It's been reported that at times this treatment is recommended because they're trying to reduce suicide risk. Can you tell us a little more about that?
Sure, that is the purported benefit of this therapy. However, there have not been studies to show that there is a reduction in suicides. In actuality, in the LGBT community, the suicide rate based on transgender LGBT surveys is about 40% in this population, which is 10 times higher than the general population in the United States. There was actually a study that is often quoted that was performed in Sweden, looking at 30 years of individuals who underwent sex reassignment surgery. And those individuals were still at 20 times the risk of suicide after.
So it's not necessarily affecting that desire for suicide. It's not actually a counter to that. There's one last question that I have for you, just about a recent 60 Minutes report that talked about people who regretted their transgender transition surgeries. Is this detransitioning regret something that you see often as a doctor?
Well, in my field, I work in pediatric critical care, and so I don't tend to see these individuals. However, in the clinic and outpatient settings, it's possible. The concern I have is that these individuals are not receiving the platform they need to speak because it undermines the gender affirmative therapy that is recommended. So there is an individual, Walt Heyer, who's well known. He transitioned to be a female in his adult life for 8 years and then detransitioned. He now has a website that I highly recommend if individuals would like to go and understand the stories. It's called Sex Change Regret. And on this website, he has a page dedicated to the voices of those who are detransitioning and have been misled by the medical profession.
Well, we're grateful for your expertise and for coming on this show and explaining this to us, Dr. Robles.
You're welcome. Thank you for having me.
Thank you.